So you've been given a diagnosis of fibromyalgia, but you don't agree with it. I'm increasingly seeing a number of patients in my clinics, often coming with a diagnosis of fibromyalgia from another specialist or from their GP, but they're not sure of the diagnosis. They don't agree with it because they feel all the investigations haven't been done. And I think this is a very relevant point. And I agree with a lot of patients that we probably need to be doing more before diagnosing fibromyalgia. So right now, what is the way to diagnose fibromyalgia? And I'm talking about it in the context of the UK and at the end of 2024 when we're doing this video. And what we are saying is that the main criteria that we have for diagnosing fibromyalgia is what's called the American College of Rheumatology criteria from 2016. Now, they have spent a lot of time looking at this condition because fibromyalgia was essentially, and even now, is often thought like a rheumatological condition, and it was primarily rheumatologists who were seeing it in most parts of the world. But there's been a sea change in our understanding now, and we realize that there are many other factors that can be responsible for the symptoms of fibromyalgia. For example, if you look at the treatments, or rather the symptoms that people with perimenopause have, that can often be very, very similar to fibromyalgia. If you look at symptoms that people with long COVID have, that can be very similar to fibromyalgia. A lot of patients who have had other viral infections and been left with a chronic fatigue-like picture, they can have fibromyalgia-like symptoms as well. And lastly, there are many people who might have had, for example, a road traffic accident with some concussion, or they might have had cancer-related chemotherapy or immunotherapy, and you then look at the various symptoms they have, that again ends up being diagnosed or has symptoms that get looked at very similar to fibromyalgia. When you look at this wide variation or categories of people who will have symptoms that are similar to fibromyalgia, it does argue that we need to be a little bit more careful before making the diagnosis. So what does the 2016 criteria for fibromyalgia actually say? It's a little bit more simpler criteria. It essentially looks at two aspects. One is a widespread pain index, which is out of 19. So there are areas which people have to press, or you say whether you feel pain in those areas of the body, and the denominator for that is out of 19. And there is something called as the symptom severity index, which looks at the severity of what symptoms you have. Now, these might be symptoms like fatigue, like brain fog, like sleep disturbance, or it can be other symptoms like depression or tummy pain. And each of these is looked at separately. And together, if the count is again out of 12, then it's the combination of the widespread pain index and the symptom severity score that together goes above the threshold value. So what's the threshold value for making the diagnosis? If you have a widespread pain index 7 or more than 7, and you have a symptom severity score of 5 or more than 5, that's one set of times. Or you can have a symptom severity score more than 9 and a widespread pain index more than 5. So actually quite low bar itself. But if you have any of these two figures more, then that means that it is likely to be fibromyalgia as long as the blood tests are normal and there are no signs of inflammation. But in the blood tests, the devil is in the details. We realize that a lot of times we only do blood tests for infection or inflammation. We don't look at the other tests that could be abnormal. For example, female sex hormones or any other hormone levels often are not tested. And it's important to do a full testing of your thyroid hormones, your growth hormones, and your sex hormones before coming to a conclusion. There's also the suggestion that when you have other factors, for example, if you're in the perimenopause time, or you have a history of COVID, or you have a history of road traffic accident, or a viral infection, or something that disturbed the tummy, then maybe it's important to do a testing of those areas or structures as well to make sure that they are not affecting. Because ultimately, as I've said in my other videos, fibromyalgia is not a rheumatological condition as such. It's more a condition where the nervous and immune system have got sensitized together, and indeed in some cases of extreme fibromyalgia, we're now finding suggestion that it actually behaves like an autoimmune condition. And so it's important to be aware and make sure that all these tests are done before confirming the diagnosis of fibromyalgia. I hope you found this video useful. I look forward to seeing you in the next one. Thank you for listening. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.